Question number 1 is the height of the jugular venous pulse is determined by. So jugular venous pulse means pulsation in the internal jugular vein. So internal jugular vein drain into the respective brachiocephalic vein. Now brachiocephalic vein of both the sides, right and left, join to form the superior vena cava. Superior vena cava drains into the right atrium. So JVP, the internal jugular vein, is directly connected with the right atrium. So if we see the diagram, this is your right atrium, this is right ventricle, this is your left ventricle. So from the right atrium, the draining blood vessel is superior vena cava, which is directed into right atrium. This is right brachiocephalic vein, this is left brachiocephalic vein. So this is right, this is left. Then right, this is right internal jugular vein, this is left internal jugular vein. You can very well see that this is in direct contact with the right atrium, and somewhat left is also in direct contact with the right atrium. But traditionally we go for the right sided internal jugular vein, but we can also see that in the left internal jugular vein. Number 1. Number 2, we can also observe one more thing. There is no valves between the right atrium and the internal jugular vein. So whatever will be the pressure in the right atrium will be directly transmitted into the internal jugular vein. So this is the reason that the height of jugular venous pulse is determined by the right atrial pressure. So whatever is happening in the right atrial pressure, right atrium will be seen in the case of jugular venous pulsations, waveforms. So there are two reasons. Number 1, it is directly connected, it is in direct contact, means in direct line, direct contact. And number 1, absence of valves. So A will be the correct answer. Coming to question number 2, okay, there are certain waveforms also. So there are A waveform, C waveform, and V waveform. A, C, and V waveforms will be formed when the pressure in the right atrium will increase and the pulse will go up, and X and Y descent will be seen when the pressure in the right atrium will go down. Coming to second question, the SA node. So SA node is the primary pacemaker. So it's the pacemaker of heart. It is asking, it is situated at the junction of. So we can see that here, this is SA node. So this is superior vena cava. This is right atrium. So SA node is situated at the junction of the superior vena cava and the right atrium. So answer will be superior vena cava and the right atrium. So A will be the correct answer. Now, high output cardiac failure is caused by which of the following diseases? So what is cardiac failure? Cardiac failure is a condition in which the blood pumped by heart is not adequate for the needs, of body. Now this can be because of the low output, that heart is not able to pump the blood. For example, the heart is having some pathology. For example, after MI, there is damage to myocardium and the heart is not able to propel the blood. So it will be known as low output. But there are certain conditions in which heart is acting properly, but still it is not able to do so, and the heart is having high output. The heart is increasing its output, but still it's not able to meet the demand. So it is known as a high output cardiac failure. So they are asking for the conditions which are the high output cardiac failure. So the first option they are asking is beriberi. So what is beriberi? Beriberi is because of the deficiency of thiamine, which is vitamin B1. What is the role of vitamin B1? It is involved in the aerobic metabolism of glucose, of carbohydrates. If aerobic metabolism will not occur, what will happen? Anaerobic metabolism will happen. Anaerobic respiration will take place. Anaerobic respiration will lead to production of lactic acid. Lactic acid is a vasodilator. If there will be vasodilation, vasodilatation, then it will lead to the decrease in systemic vascular resistance. If the systemic vascular resistance will decrease, it will lead to the increased venous return. If venous return will increase, it means preload will increase. If preload will increase, it will lead to the stretching of the heart by the Frank-Starling law. It will lead to the increased cardiac output. So first is correct. So this is high output cardiac failure. So first is correct. In second case, severe anemia. So again, severe anemia will lead to the hypoxia because hemoglobin is less. That's why it is not able to produce the right amount of oxygen to deliver to the tissues. So there will be hypoxia in the tissue. It will lead to the production of the metabolites. Which will be accumulated here like nitrates, adenosine, etc., or lactate again, which will lead to the vasodilatation, which will lead to the decrease in systemic vascular resistance, which will lead to the increased preload by increasing venous return. Then it will stretch the heart by the Frank-Starling law, and there will increase cardiac output. So the pathology is same after vasodilatation. So there will be occurring vasodilatation, which will lead to these things: increased systemic vascular resistance, then there will be increased venous return, then there will be increased preload, then there will be increased cardiac output. So again, in severe anemia, there will be heart failure, there will be high output cardiac failure. And then thyrotoxicosis. Thyrotoxicosis means increased T3 and T4. So basal metabolic rate will increase. Then again, accumulation of metabolites, which will lead to the vasodilatation. So in thyrotoxicosis, there will be vasodilatation, therefore leading to the decreased systemic vascular resistance. So there will be increased venous return, then there will be increased preload, it will stretch the heart. So by the Frank-Starling law, there will be increased cardiac output. So the pathology is same, that in all the case of heart failure, there will be vasodilatation, and after the vasodilatation, the cardiac output will increase. But thyrotoxicosis has one more mechanism, and that is it stimulates the beta-1 receptor. So the beta-1 sympathetic receptor, so it will going to stimulate the beta-1 receptor on heart. Beta-1 receptor has two functions. It increases the heart rate and increase the contractility. So contractility will increase and heart rate will increase, which both will lead to the increased cardiac output. So this is high output cardiac failure. So 1, 2 and 3, all of them are correct. Answer will be D, 1, 2 and 3.